Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County branch of the American Association of University Women, one of the civic partners for this show. Today we have two guests in the studio, Jeanette Zoeckler and Relani Prudhomme. They're both with the Occupational Health Clinical Center, which is based out of Syracuse, and we're going to be talking today about the Low-Wage Worker Health Project, which has been an ongoing project that OHCC has been doing now for several years. Jeanette is the Director of Research and Special Projects, and Relani, unfortunately for her, is the outgoing Education Outreach Specialist in the Canton office, which is, because of funding cuts, going to have to close, unfortunately. But we can still talk about what you folks have been able to do in this area, and maybe a little bit about where we're going to go in the future. So, Jeanette, you've been spearheading the Low-Wage Worker Project from the very beginning, and we're now actually in phase 5. Can you give us some background on the mission and methodology of the project so we get a sense of how you've been working, and then we can get into some of the results?
Sure.
Thanks.
Well, it's been great that this, in phase 5, we finally were able to bring our methods and ideas into the North Country. Although I think that thinking about workers and their health was happening in this community long before we decided to work on this here. But the whole idea of the Low-Wage Workers Health Project is to go into the community and find where low-wage workers are convening themselves for whatever reason, and put together a workshop for them that really helps us to have discussions. We learn from the low-wage workers about their working conditions, and we also help people think about their workplace and their health in light of the conditions that they face. And so we have been doing, the methods are the fun part. I mean, we do these body mapping exercises. We often have people map the workplace. We think about, together we sit around in small groups and discuss and allow a space for discussing whether people are knowing their rights in the workplace and knowing how they might strategize to use those rights. And so that's been the crux of the project over time. I think that we've reached, in each phase, we've tried to add or develop what we've been doing. And we had some funding from the New York State Department of Labor the last couple of years that allowed for an expansion. And so this year, the expansion was in 4 upstate New York regions. We were able to pull together a team of really experienced trainers, if you will. Well, I don't always use that word, but training people to keep their eye on their workplace. And Relani, was able to use all of the connections that she has and reach into this community in the expansion this year.
Okay, well, one of the things that has happened since the economic downturn about 10 years ago now was that a lot of the new jobs that have been created are in these low-wage areas. And in fact, there's about 65 million Americans who have a low-paid service job, and too many of them have no or very limited access to health care. Their on-the-job training may not be that great, and we know there are workplace hazards in every job. And the physical injury and the general wear and tear of this kind of work has both short and long-term effects on their health. So let's take a look at the results of the project to date. What have been your major findings, Jeanette?
So we've talked to now, considering the expansion, we've talked to over 1,300 workers directly in these groups. And one of the things that we have learned about them, and we should define low wage. I mean, we're really looking at folks who make less than $15 an hour generally. So people who are struggling to make ends meet generally in our communities. So looking at their situation, I think that what jumps out at you immediately is their wages and hours are very different than what we think of in a traditional real job, if you will. They get part-time hours, they get sporadic hours, they have jobs that are what we call precarious. We're not sure if they're going to be employed in 6 months. They don't necessarily stick with this job. This isn't a career path. This is a dead end, really. And we used to think about these jobs in terms of, maybe young people should get their start with work habits and these kinds of jobs, or maybe you did it as something extra on the side. But now these jobs are, for many people, are the bread and butter of their income. And so that's a shift in the kinds of folks who are working these jobs. So those wages and hours problem often include wage theft. And what often goes along with wage theft is health and safety problems on the job. But what we should talk about with wage theft is where people are being exploited for their pay. They don't either know exactly what their pay is, or if they do, it's being shorted in some way. They're asked to come in early off the clock. They're asked to provide, equipment that they shouldn't have to, or other supplies. They're asked to do work without any vacation pay. They're asked to there's very few benefits with these jobs, which is really important to understand that the arrangement isn't clear, often less than formal.
I did a show a little earlier this spring with someone who was talking about the situation that tip workers find themselves in, and often when they get their paycheck, there is no wage in their paycheck. It is simply some kind of a tip sharing thing, and their wage is very low to begin with, so they really have no idea if they have been actually allotted the tips they should have got, because there's no record that shows up in their pay stub. Same.
Right, and so the tip workers have that issue, but many other workers do too. The pay stub is very unclear about what exactly is the pay. Part of that is just we need to all learn to understand our paycheck and how it works, but another part of it is that it's games being played, with the hours, and then people are shorted unjustly, and those are violations of New York State labor law. But another thing in our finding, because we have been concentrating on people's health, is to think about what exact exposures and what exact potential health effects do these exposures have. And so many of these jobs are service jobs. So we don't think of them as so dangerous, we're not as worried somehow. But what we find that over time, first of all, a lot of times service jobs do have cleaning aspects. And so people are exposed to chemicals kind of really without any training whatsoever, because it's kind of just an add-on to their job. Another thing that people are exposed to is just long hours of standing or long hours of sitting, neither of which are good for our health long term. People speak a lot about stress. They're either on too many hours or worried a lot about their work arrangements. Also, stress comes into play when there's too much demand. So people are working short-shifted situations. So a good example is a certified nursing assistant, paid very little, asked to work extra hours, long shifts on a shift where there aren't enough workers to actually do the job. So they're asked to hustle and move faster, and that creates environments where there are dangers of many kinds.
There's actually been some talk here in New York State about folks who provide in-home service, and they may have a 24-hour shift, but they're only being paid for 13 hours. The assumption is they're asleep, but they're also on call. And so a lot of those folks are having a lot of trouble making ends meet because they're being shorted for the hours that they're actually on duty. And certainly anybody who works as a home health aide is exposed to a lot of physical work, and also you can be exposed to some medical dangers, can't you? Just in terms of someone who's not healthy to begin with.
Yes, and all sorts of, we find that the home health aide is one of the most dangerous jobs because the home is not a regulated space, and honestly, you can run into pets, you can run into dangerous people, you can run into difficult neighborhoods, you can run into, the list is about 50 things long that home health aides can be exposed to. Lead in the home, now they're exposed there, they're exposed to, a lot. And so, and that's also another situation where it's unclear, you show up for the client, they're not home, so now you're not getting paid, which seems, ridiculous, but that's kind of often how their pay arrangements are set up. So these things really denote a lack of dignity, which is the number one thing that low-wage workers report as being problematic, even over and above the low pay that is causing them to have other health problems. And the lack of dignity where people are treated as though they are less valuable as human beings than others. So they're often harassed, there'll be some kind of incivility or what we call workplace violence on a continuum. Maybe it's not as though someone's going to assault them today, but if day after day you're yelled at, you're not called by your first name or any name, you're just referred to and denigrated, then those things, we do believe that kind of stress actually has long-term health effects. We know it does, but in addition, people are studying, what is that additional layer of this just isn't worth it. I'm not being paid to be treated badly. Also, these jobs have what we call emotional labor, where you are required to be super nice, customer service, you're required to care about these other people. It's a part of the job to give your emotions out there. And those kind of stressors are frankly usually in the past associated with higher paid positions, a social worker, a teacher, a nurse who has training. So these emotional outlays are costing people long-term health effects because of stress on they're taking it home, they're ruminating at night, they're worried about these people that they've interacted with, and sometimes, we have woefully little training. A home health aide has, for example, 10 hours of training. It's not enough to know how to handle difficult situations in the home and complex interactions. So I think that another thing that we have found is that there are barriers for workers to try to improve their health conditions. So they may notice that the conditions are being exposed to chemicals, or they're being exposed to prolonged standing, or some kind of repetitive motion where they have to, repeatedly do the same tasks. Those conditions they try to change, but they are either worried they'll lose their job if they speak up, or they don't know how to go about it. There's not an apparatus set up in our society where people can just make a logical complaint and try to make some health or safety conditions improved. And so they have the rights. Their rights are there by law, but they either can't exercise them or won't for fear of losing their job. So those are the barriers we've tried to overcome.
So just because the law exists, if the reporting mechanisms and the redress mechanisms aren't readily available, the law does not have much in the way of teeth, does it?
Right, and most people will just laugh at me when we talk about those parts. Oh, yeah, well, does it? Their reality is in these communities, even in larger cities and in smaller towns, it's even more so. People will get to know if you're the kind of worker who likes to speak up about these sorts of things, and employers will sort of informally blacklist workers. And even in a city the size of Syracuse, people say, well, I won't work again in these neighborhoods if I say anything at all. Even something as simple as requesting gloves in a dishwasher of a restaurant, which, because someone's hands were having a rash and they knew that it was clearing up when they were away from work. So that's a classic work-related connection. The condition improves when you're away from work. They couldn't even ask for a pair of gloves because they feel like they're going to get fired. And they're raising children on these incomes and they can't afford that. And so finding ways for workers to understand that they have some power, to come alongside them together, decide together with them what are the next steps, those kind of strategies, either in simple situations or in very egregious situations where there's unconscionable conditions that need to be cleaned up. Both the simple and the more complex situations need attention. Because many people are faced with sort of what we might think of as minor health things that could easily be improved with some practical basic things.
Right, so, and just with a little bit of workplace education, both for the employer and the employees.
Sure, there can be things come too quickly. It's not a matter of just always calling an OSHA, but other times, we really can and should call in the regulatory remedies when needed. So the project attempts to reach people, find and help them understand to look at their workplace with a new set of eyes. We have had a lot of help from colleagues who helped us design the project by reaching out to people all over the country, really, because in other cities people have done these things before, So that's how the project developed. And I was so glad that Relani she had already been doing work around Know Your Rights, we call it, where people can understand at least what their basic rights are. And we were just able to spend some concentrated time getting new connections and really expanding the things. So I'm really grateful for how we have, geographically up here, as it's different. People are different. They work at different jobs in some situations, and really it's interesting to bring in the geographic differences, that come up.
Because again, what you're talking about is getting to people where they are, and that means you have to be able to walk the walk and talk the talk of those folks.
Yep.
Relani, there was a specific part of this last project that was focused here in the North Country. Talk to us a little bit about how you've approached workers in the North Country and what those folks have had to say to you about conditions that they're working under.
Well, I have, as Jeanette was saying, I already have been doing these Know Your Rights talks as a part of a collaboration with Cornell Cooperative Extension and their job readiness training that they offer in Ogdensburg and Canton and Messina. So they regularly meet with people who are receiving GSS assistance and are actively searching for work, and a lot of them have low-wage work experience. Some, are actually good union job experience, but, are looking for work and may end up in low-wage work jobs. So with Jeanette's help and others who helped to put together this curriculum, we've gotten special permission to expand what we've been doing to a longer session that would be up to 3 hours long, where we could really go into more depth, because then the following week and the week after that, I wouldn't be able to see the same people. Mm-hmm. So really capturing, that group of people in a 3-hour session has been good, and able to go through some of the body mapping, some role play. So, once you know your rights, think through a situation where you're trying to assert your rights. How would it work? What would be the barriers that you'd encounter? And then what? What would you do? What would you say? Who would say what? And so that's one group, is with programs like that. And also we were able to, for the first time, do an expanded session like this with farm workers on a dairy farm. And that was a really particularly interesting experience.
And we know that up here, the dairy industry has changed. From a lot of us grew up with the small family farm where it was the farmer and maybe his wife or his child who was working with him, and now we have these very large operations where there's actually full-time crews that run 24/7 and milk three times during a 24-hour period. So it's very, very, very different. Exposures to hazards are very different, and farm work is just dangerous anyway, under the best of conditions, but when people are working like that in the middle of the night, maybe there are some additional hazards, aren't there? True.
Well, animal handling is a big one. Mm-hmm. Almost every farm worker that I've talked to has been kicked at some point in time. Recently, I helped somebody get to the hospital who had been attacked by a bull, who was just rampaging on him, and he was completely alone and, suffered a concussion. So there's some of those more, acute injuries. There's the repetitive injuries, because it is more of a factory setting, where you're doing the same thing for a 12-hour stint, with some rotation. But chemicals are a big deal, and that's one of the things that came to light with the body mapping, is a lot of the farm workers during the session were pointing to the same body parts. You actually map them out, and you can see where there's a lot of red dots right around the eyes, or in the chest. What's that about? And then people start sharing, well, it's this new chemical they've been using, and so then we talk about what are your options. Okay, so you could make an OSHA complaint. Well, we don't want to lose our jobs. Okay, well, you can get somebody to help you to formulate a complaint and be a worker representative with OSHA. That's another thing. You can also call OSHA just to ask questions, and they do have Spanish-speaking people there as well. A lot of people don't realize that you don't have to just make a complaint. You can call and just ask questions. You can talk to us. And there's also NICAM that specializes in agricultural health and safety, and they cover the entire state. And they do trainings through the North Country, so you can contact them with questions about the chemicals and what needs to change. And they can come and speak with the employers and do trainings and give options. We also have an industrial hygienist as well in our Syracuse office that travels, and so if, say, an employer was interested in making some of these changes, he could go and assess, the situation and make recommendations for
Relani, talk to us a little bit about these little booklets that you have put out from the Occupational Health Clinical Center, and it's about protecting your health and safety. What kind of information's in that, and how can folks get a copy of that?
I am going to defer this one to Jeanette, because this is the first time I'm seeing these. I'm excited to see they're really nice. Yeah.
Well, I just want to point out one of the most important things about what she just said, backing up for a second, was how we connect workers to resources. She just described a scene where she is explaining all the options people have, and many times the low-wage workers not just on farms, but everywhere, just don't know what their options are. Who's on their side? Who can they talk to? What can they do? And so there are worker centers in Syracuse that can help. There are COSHs, there are councils on occupational safety and health who have expertise, who can help workers walk through, what are my next steps? How can I ask? And the role playing she described is so important because very often people haven't felt they could speak, but now they practice with each other, saying, you know what, I'm having a rash because of my hands are in the dish soap. Do you wonder if we could get gloves? They haven't practiced that just act of asking, and someone plays the boss and says, well, get back to work, I don't have time to deal with you. And then, well, sir, I really think, and really kind of getting people out of their shell to talk about what's going on in their work, that, they don't have a chance once you do that. So that's really important.
And it sounds like the other advantage of that is that when you go to the boss and say, listen, this isn't just my problem, it turns out 5 other people are having the same problem, so this is really a workplace issue. It's not something that I'm just complaining about, and that's got to help too when you start doing that negotiation and you have a lot of people who are all talking about having the same issue.
Right.
Well, that's one of the best things that I think that comes out of this whole session is that people get to talk about it as a group and realize that there's sort of a gestalt, that this isn't just me and in my head, because that's one of the biggest barriers that I see is people's individualized focus, that, it's my problem and, I need to keep myself safe and it's all my, my responsibility as the worker. Whereas, we're trying to break it out and show the collective experience and the power dynamic of, the employer actually has the most control over the workplace conditions. So if there are ways to reduce those hazards or eliminate them, the employer has the most control to do that. But how do you as an individual get that done? It's really, really hard, next to zero, possibility. But if you as a collective can come, there, your voice is going to be stronger anyway, but you also have more protections, with the National Labor Relations Board, they will back you up if you have some, what they call concerted action. If you have 2 or more people asking for something, whether it's for health and safety or even for a wage increase or other kinds of changes unrelated to health and safety, your job is protected because that's concerted action. So those kinds of things, and helping people to look at things more from a group perspective, I think is one of the biggest objectives that I have with this.
Good.
Yeah. So we did develop these. These were developed by with Mid-State COSH, which is a Council on Occupational Safety and Health in the Southern Tier. And what these are typical questions that people have about their work-related health and about other issues related to work. They're some of the most common questions that people have. We put it into a kind of a colorful, attractive, smallish handbook so that people could maybe take it and just look at the kind of questions they have. And then it recommends resources as well. And we're such a network that any resource recommending to us in Syracuse, we're going to be able to get closer to people as we can. So these are available online as well as in this print from us, and I think that they can be effective ways of just, what is sexual harassment? That's all in the news today. What are your actual rights? What is workers' compensation? How does that work? What are the basics of wage theft that we talked about earlier? What if you're an immigrant? What if you've come here from another country? Do you have the same rights? And in many cases, there are more rights than people realize they have. And so what about those questions, and who can be called upon to help? And so this was an important handbook for us to be able to, share more information.
Right, that's a great resource.
We're hoping to put it into an app and maybe make it more interactive online as we go forward. But
Well, the truth is that low-wage jobs are here to stay, in all likelihood, and the research tells us that once you are in a low-wage job, it's really hard to get out of them and move back. There was a recent study called "Can Low-Wage Workers Get Better Jobs?" The authors looked at 175,000 workers, and basically what they found was that only about 5% of those people a year later had actually improved their job prospects, and 10% of them had actually left the workforce. So, your chances of moving on up are not very good, are they?
There's not much of a path. I mean,
No.
when I talk to the low-wage workers, many of them are 5, 7, 10, 20 years into these kinds of occupations. There isn't a plan for many of them. And in the past, labor unions fought for those kinds of jobs. Are not that interesting really, they're kind of boring, but people fought to have better pay and better benefits when you're in those kind of working conditions. And it's important work that undergirds everything that we do in our society, keeping things clean, keeping food moving, preparing food for the next phase of serving it, cleaning up and taking care of the most basic medical care for persons with disabilities or people as they age. These are huge issues in our community that we are expecting low-wage workers to carry on their backs. So it's super important that we consider their work valuable and think about advancing wages and cleaning up any bad conditions. Creating this workplace level change is the challenge for us. Finding ways to structure our society so that there is some kind of better than just some hoping they run into some information like we can give. It's not blanketed nearly enough as an integral part of what we do. So we have to think about the fact that unionization is down. We have almost no knowledge of what it means to collectively bargain for anything or change from that kind of structure. So we need to build and find ways to change our social structures. One way of doing that we're pursuing is finding ways to turn other people, all working people, into an occupational health promoter themselves. So instead of Relani and I spending a lot of time going out and doing it, we can and we will, but others can be trained also as lay people in the community that can know the basics around these issues and know how to connect people to resources. And so we're really looking into doing what would be classically called train the trainer. But the idea would be that others in the community can promote occupational health and become those kind of promoters, so we can set ourselves up with large groups of individuals who are equipped to go take it further, take these messages further.
You make a good point about unionization, because really a lot of the reasons that unions organized, it was not so much about the pay as it was the safety and working conditions, and then the pay was something that came out of that. New York State actually has the most unionized workers of any state in the country, and we don't have very many of them anymore because unions are at a very low point right now. When you look at the number of people who are doing these kinds of work, these are prime candidates for unions, aren't they? And for that kind of collective bargaining for health and safety issues as well as pay and benefits. So this is really a wide open area of great need amongst the working population in our country.
Sure, it used to be there was a memory of the unions, and if you weren't in a union, you knew someone who was. So now you have when I speak about unions, or if we have a couple of union people that happen to be in our groups, they often can speak to it and help people understand what the benefits of unions really were, especially when they were organizing, and people just aren't used to thinking about those jobs as union possibilities. But I think we're seeing in large cities across the country that is changing, and people are collecting themselves and saying, hey, we're not getting a fair shake with pay, we're not having safe and healthy conditions, we're being overworked, worked to death, and we just don't want to be in that situation anymore. So I think that awakening that mood and will help all the people get more what they need, because health at the end of the day is what we've got.
That's right.
And to have people being used up and exploited for their health at work is just not something that we should be accepting, as a way of being.
So as we wrap up, any final thoughts from either one of you that you'd like to share with the audience about this project? Where's it, where it goes next? Or is there going to be another phase?
Phase 6, well, one of the things we're committed to is to continue. So we have to look for sources of funding if we're going to continue the kind of expansions. But phase 6, I do think, is going to end up landing us within some occupations, within the home health aides, within some fast food workers, within the construction workers that work on the low end of the gophers, that are doing the harder work but not as
the human
protected
forklifts.
as much. Those kind of construction workers. We'll have to start focusing on some of these, specific groups in order to find out their problems and start addressing them. That's probably one. And then, like I said, the community health promoters really is a way to expand the project without on a shoestring, shall we say.
Yeah.
And well, it's my hope, specifically in the North Country, along that vein, to develop community health promoters among youth. And so that they can, I think that you find when you're talking with youth on youth training has been found to be more effective. You know, listening to your own peers, that there tends to be more buy-in. You know, so.
Yeah, and I think the other thing that probably happens is when you have these folks that are trained like that, they're much more aware of workplace issues, and they can spot maybe a health and safety issue quicker than folks who aren't really talking to each other can, and then they can initiate the conversation about getting the group together to start to address it, as you were talking about earlier. So there are lots of solutions out there, aren't there?
There could be,
Yeah,
we
so-
feel hopeful, yeah.
Well, let's hope that education around these issues, that like the OHCC does, and other like unions and other groups, will make a big dent in this. Thank you both for coming in. These conversations are a production of North Country Matters, which is filmed here in the Fred W. Cleveland Computer Center of the Potsdam Public Library. The civic partners for this show are the American Association of University Women of St. Lawrence County, the League of Women Voters of St. Lawrence County, and the Potsdam Public Library. Until next time, remember, our North Country matters. Jeanette, thank you so much. Relani, thank you so much.
Thank you.
Okay.